Hello there, my name is Eduardo Lopez, and today I'll be your first presenter for multiple sclerosis. I will also be accompanied by Carlos Fierro and Seth Falcon. You'll see them later on in this video doing their own section of this presentation. Now, let's continue. Description of multiple sclerosis. Multiple sclerosis, or MS for short, is an autoimmune disease that affects the myelin sheet coverings of axon lines on neurons. Now, basically, what happens is that the immune system attacks these myelin sheet coverings and damages them and corrodes them away, which exposes the axon line, which is bad because the myelin sheet coverings act as a insulator and an improvement for communications. And once these corrode away, they expose the axon line, which can lower communications or even stop communications completely, which can lead to neurological damage and complications. Now, MS is an autoimmune disease, which means that it pertains to DNA and heredity issues. So basically, there's an issue in your DNA that causes this autoimmune disease to happen, or MS. Or you can get it from your parents through heredity, or basically receiving it from them when you were born. So you can already have MS and not know it and develop it later on. Now, these slides were created to explain MS in more detail, which you'll see later on in this presentation. Let's continue. So, you have a description of multiple sclerosis continue. So here you have a healthy nerve. There's an axon. And it has the myelin sheath coverings that are covering the axon, which protects it and insulates it and improves communications. So here on all the way on the far right, you have a neuron and you have damaged myelin. So you have exposed fiber, damaged myelin, and the signal is really choppy and bad compared to the left where the signal is nice and strong. Because of this, it can lead to neurological issues and problems within your nervous system. Causes or risk factors. So, although scientists don't really have a full idea on what causes MS, we do know that women are two to three times more likely to get MS compared to men, which can be related to DNA compared to between women and men, which can lead to more likely to get MS. And we also know that in places where the sun is less visible or you get less vitamin D, can lead to you having a higher chance of having MS. So, for example, New Zealand, Southern Australia, Europe, the northern United States, they have more cases of MS than really down near the equator where the sun is more visible. And also down here, smoking can also further grow the effect of MS symptoms and therefore worsen MS. So here you have the statistics, or not the statistics, sorry, the causes and risk factor continue. So here you have they are basically statistics. We have 3 or 4 to 1, which is basically means that women are three times more likely to have MS than men. So 15% have one or more family member or relatives who also have MS. Identical twins have 1 in 3 chance to also have this disease, meaning it's mostly an issue with DNA and other stuff related to that. So on the far right, you can see the places where it's more relevant, like Canada, places in Europe, Norway, United Kingdom. And Canada tops it with 291 reported cases or rates per 100,000 individuals. So Canada is in a higher percentage. And that is it for my section. Seth will now continue on this presentation, and I'll leave it to him.
So next we have the symptoms of multiple sclerosis. So what multiple sclerosis does is that it damages the myelin, which is the protective nerve fibers around the user's nerve. As it does this, it disrupts the nervous system messaging to the muscle fibers and cells, which can result into twitching, spasm, and fatigue. On the bottom, we have the most common symptoms, which is numbness in limbs, uncoordinated locomotion, locomotion is basically walking, eye pain, found back, dizziness, fatigue, slurred speech, double vision, uncommonly great urge of irritation, various mood swings, and difficulty doing everyday functions such as swallowing, thinking, and blinking. Over here on the left picture, we got a normal nerve, which is unaffected by multiple sclerosis, and in the bottom we have a nerve that is affected by multiple sclerosis, which you can see has a damaged myelin and exposed fiber, which that exposed fiber is called the axon, which is the one that does the messaging to the muscle fibers. And on the right picture, We have the speech. We have the symptoms of multiple sclerosis, of course, and as you can see, it affects speech. As I said, slurred speech, throat, heart swallowing, the sensation with twitching, and the urinary system, which uncontrollable urination. Um, and then next we have the prevalence amongst the U.S. population. So thankfully, multiple sclerosis is a pretty rare disease, with only 0.32% of the total population having multiple sclerosis, which is about 1 million North Americans. However, the from 1925 to 2017, multiple sclerosis rates nearly doubled. And if you put in a ratio, you can see that multiple sclerosis actually increased, mainly not due to the population, if you get what I mean. And you can see in the left picture from 1925 to 2017, again it doubled. And you can on the right side with the bars, the gray bar, what it means is that for every 54 people out of 100,000 Americans, 54 people have multiple sclerosis. And the orange bar for which is 2017, for every 365 people out of 100,000, 365 people had multiple sclerosis. Thank you. This has been my part.
Cures and treatments. There is no known cure for multiple sclerosis, or MS for short. Treatments can only help prevent the further progression or slow the progression of the disease. There are two ways. The first is to use steroids. Steroids will help reduce the nerve inflammation, but they will have a negative side effect on the body. Another way is to use plasma exchange. In this process, the blood plasma is taken from it, and protein solution is replaced with it. After patients have gotten these type of treatments, there's also additional treatments the patients can have, such as physical therapy, muscle relaxants, and other types of medication. There's also an FDA-approved therapy. Patients that are able to receive this type of therapy will have a better odds of showing a slowing of progression. Patients are also capable of having a relapsing. In case of a relapse, they should have a treatment in order to quickly respond to this, in order to reduce the risk of having any type of injury. The references we had for this slide was Mayo Clinic, National Multiple Sclerosis Society.